So we completed many topics in electrohomeopathy. One final topic is left, that is 45 points in electrohomeopathy. Okay, or we can say body points for external application in electrohomeopathy. Okay, so basically, this is purely depend upon law of polarity. So yesterday or previous class, I told you that about law of polarity. So our body have two poles. So our body is divided into two halves. Okay, you can see here this this is the right side. Okay, and this is the left side. So basically, right side of the body have negative polarity, and left side of the body have positive polarity. And you can see that this the middle portion. You can see that this is the neutral part of the body. It may be uh, posterior, it may be anterior. Both have neutral effect. Okay, you can see that what are the positive parts, what are the negative, what positive parts, what are the negative parts and neutral parts. Okay, so based upon this theory, first based upon this theory, second is you can see that our body have peripheral nerves. So let's see the image.
Yes, sir.
So here you can see that our human system, human body have surrounded with nerves, okay, which have deep connection with every part of the body with nerves. You can see that this is the central nervous system and this is the peripheral nervous system in the hands, ribs, stomach, pelvic region, thigh region, leg region, foot region, ear, hand. So in every inch you will able to see the nerves in the body. So okay, you can see that every part of the brain have the signaling capacity. Okay, and second is that the spinal cord will have the nerves connected with the organs. You can see that the pupils, saliva, airways, heart, stomach, and liver, intestine, bladder, genitals. Okay, but here parasympathetic, sympathetic nerves are described. But this is the type of peripheral nervous system. Okay, pupils. Okay, salivation, airways, all these are connected to the peripheral nervous system. So this is observed by Dr. Count Caesar Madhe, and he advised and he practiced to apply the external application. Like he had a dog which is suffered from the severe type of wound, unhealing wound. So he saw that the 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 dog is eating the plant, the plants, the leaves, the plant leaves, etc. And he is rubbing his skin to the plant. So this thing trigger him to make external applications. Okay, and why the wound is healing? Because we have the nervous system. Okay, so and we have two things here. The nervous system, further nervous system, you can apply the external application. Okay, first. Second thing is that the body have poles, positive poles and negative poles. For two purpose, you can apply the applications. So basically, in the beginning, number of doctors practiced only electricities because our body have right side positive, left right side negative, left side positive. So positive electricities for right side and negative electricities for left side and neutral electricity for center of the body. Initial. After that, number of physician practice different things and they apply external with the other remedies. Like we have the in the electrohomeopathy, you have 2 to 3 remedies for external application like F2, WE also, okay, REYE, BE, blue electricity, GE, green electricity. Okay, and F2, WER2, and APP. So these are the remedies you can use externally. But some physicians started to apply the remedy which are given internally. They are also advised to apply externally. Okay, so this is also started. Other physicians started to give according to their experience to apply externally. Okay, first we will discuss 45 points, and at that point, okay, what type of diseases we can treat. Okay, secondly, and thirdly, what remedies you can apply. So these are the three things we will discuss in 45 points externally described in electrohomeopathy. So let's see uh, one image. This is the image, you can see that. Okay, these are the 45 points we have from top to bottom. You can see that this is the positive side, this is the negative side. Okay, the central part is positive, negative. So you can see that there are the points in the face, chest, abdomen, thigh, knee, okay, legs, and foot. So let's discuss everything, every point. So you can see that first point is supraorbital nerves. What are the point? First, supraorbital nerves. So let's see the image of the supraorbital image, and we have infraorbital nerves, base of nerves, bronchial nerves, solar plexus, pit of stomach, gastric sympathetic nerves, crural nerves, region of lungs, back of ear, angle of jaw, lumbar region, navel or umbilical region, great hypoglossal region, sciatica nerves, arc of foot, small hypoglossal, optical nerves, cervical sympathetic nerves, coccyx, and we have sacral nerves, nerves of knee joint, perineum, region of kidneys, hypochondria, pubis, region of urinary bladder, region of heart, ovaries in female, cervical spinal nerves, dorsal spinal nerves, lumbar spinal nerves, nerves of ankle joint, flexor muscles of foot, extensor muscles of foot, flexor muscles of hand, extensor muscles of hand, palpebral muscles of eye, temple or temporal, arc of aorta, forehead, masseter muscles of jaw, inferior dental nerves, head of femur, vagus nerve, and top of heart. Electrohomeopathy fluids used externally on nerve endings and sensitive part of the body to obtain a quick result. Can choose the remedy according to requirement and condition of the patient. Okay, so these are the 45 points which you are going to talk in detail. Okay, so let's see the able to see. This is the
Yes, sir.
first point where you have to apply supraorbital nerves. So this is the supraorbital nerves. Okay. So here we have also supraorbital nerves, both side. Okay. Here you can see, you can put your finger here, three fingers. To till the three fingers, we can see the supraorbital nerve. Okay. So basically, this is very good for all types of eye disorders. Okay. And this nerve is helpful for to heal the eye issues, okay, and eyelid problems and drooping of eye, okay, and we have problem of like facial paralysis. During facial paralysis, you are unable to wrinkle or like this you want to do, but you are unable to do during facial paralysis. Okay, so these are the things. Okay, you can see what are the things you can observe during the damage of these nerves. You can see that here you have the pain, mostly this area. Okay, and you can unable to touch this area. Okay, okay, whenever you want to touch, and tenderness is there. Okay, and these are the things we can see that. Okay, so for this type of diseases, you can advise to apply the external application. Here, headache or facial paralysis or paralysis of this frontal region or unable to lift the eyebrows. Okay, so these are the things we can see to ask the patient and advise for electricity application. So right side is negative. So right side you have to apply positive electricity RE, and left side is negative. You have to apply left side is positive. You have to apply negative electricity, that is Y. So for that you can apply F2 also. F2 RE here, F2 YE here. First is direct one electricity you can give. Second is you can advise F2. Here you can see that if there is an infection, due to the infection, due to the heat, due to the coldness, why this nerve is damaged, why this condition is happened to the patient. So according to the condition, you can make third formula. Like you can see that this is due to the infection. Assume that this problems occurs due to the infection. So what remedy you can apply? F2, okay, F2 and right side RE, okay, word 2, okay, left side F2 word 2 YT. So likewise you can make formula, or like you are in another fourth and another formula you can see that, that is uh left side of the heart you can see A2, right side of the heart we have A1. Likewise right side again you can ask A2 F2 word 2 A2 RE. Left side you can add F2 word 2 A1 YE. So likewise you can make the formula. So in which dilation you have to apply, this is the question, and how many times you have to apply. So basically 3 times, 3 to 4 times. Directly you can apply. Okay, you can take the liquid and you can apply. Okay, so you can rub it just circular motion. Okay, and in which dilution according to the condition. If it is chronic, start with D4 and with D6. If it is uh, acute, start with D6 and with D4. Okay, likewise you can make the formula and the dilution. Okay, so I think you understood about supraorbital nerve. So this is the first point of electrohomeopathy. Next we have infraorbital nerves. Infraorbital, this is the thing where you have the infraorbital. You can see place the 3 fingers here, above 3 fingers, below the eye 3 fingers. So you have that area is for infraorbital nerve. So everything related this area you can read with this help of infraorbital nerve. So let's talk about what functions infraorbital nerve do. Okay, infraorbital nerve functions. So what it will do, it will make your eyelid, lower eyelid, to go forward. And you can have the muscles here, smiling muscles when you want to smile. So it will help for smiling purpose also. And you have lacrimal gland here, which will release the lacrima. Okay, to release the eye water. So it will help to release the water of the eyes. Okay, so uh, and and the skin which present here and at the nose level, base of the nose or external part, so it will supply the touching sensation also. Okay, so if this area doesn't have sense, you can think that there is a damage of infraorbital nerve. Supraorbital nerve, infraorbital nerve. Okay, so same same application, you can apply this area. F2, RE right side, F2 left side. Okay, so this is the third thing you can able to, second thing you can able to understand about the point of electrohomeopathy. This point number 2. Next is point number 3, that is the base of the thumb. You can see that this is the base of the thumb. So at this area, you have to apply. So basically, this whole area, you can see that this is the right side, this is left side, but is here the you can see that this is the middle portion. So basically, here advisable to apply W. Okay, so basically, this area for mostly smelling. So if there are nerves which damage for smelling purpose, or the person have sneezing, okay, and he have running nose, cold, severe cold. So at that time, you can apply here, or the person is unconscious. So directly from that, uh, from this nerve, so it will activate the brain. Okay, so the person who lost smell, okay, you can advise the remedy to this area. Okay, next we have third point. So point number 4. Here we have the bronchial nerve. Okay, bronchial nerve. You can see this in this image very clearly, that the vagus nerve, the sensory nerve, the afferent nerve. You can see that this is the bronchial area. Okay, here we have the bronchial area with large amount of nerves are connecting here, mostly vagus nerve. You can see that this image. You can see that this is the brain part, mostly occipital area. Okay, and you can see that here we have the ganglion. From the ganglion, we have the vagus nerve. Okay, you can supply here efferent and afferent, both efferent and afferent, both nerves are there. Okay, so this area you can apply. So mostly right side, mostly for cough. Okay, SOB, severe or shortness of breath. Okay, so and we have cold. Okay, can apply or lung disorders like pneumonia, not pneumonia, or okay, emphysema. Okay, so these are the things in this condition you can make the external application. So mostly you can apply in not liquid form, some solid form, paste form. You can make ointment and you can apply, because we have to uh, make the remedy to continuously grow. Okay, so because cough or lung disorders are, it will take much time to heal. So there's the reason we need continuous medical remedy remedy uh, application for that area to make the to calm the nerve. Okay, so this is the bronchial nerves or bronchial area where you have to apply remedy. So which remedy mostly? Okay, know that this is mostly P2. Okay, right side P2RE, left side P2YE. Okay, or else we can make F2 P2 RE, F2 P2 YE. And if there is damage or structural changes, we can add C group also. Infection is there, pus is there, or else any obstruction is there. So according to the condition, you can add the remedy. Okay, so this is the bronchial area, bronchial nerves. Next is solar plexus. So let's see the solar plexus. Next, we have fifth number, that is solar plexus. So basically here we have can see that this is the solar plexus. Number of here you can see that this area. Okay, this area you can see this is the solar plexus. Many number of nerves are bundle of nerves are there. So where the nerves will terminate to other parts. And we have another image also. You can see that this image. Okay, you can see this. Okay, so this is the solar plexus. So basically, this is the center of the mostly above the umbilicus. Okay, umbilicus. You can see that 5 inch above the umbilical area, 4 to 5 inch area. So where can you mostly here we have the epigastric pain, burning sensation. So you can advise the remedies regarding the mostly abdominal pain, gastritis, flatulence, indigestion. So these are the problems you can manage in that area to use electricities, mostly WE, or else alternately you can use RE, because it is neutral area. Along with you can use abdominal remedy like C15 or S10, C10. Okay, and word 2, mostly you can use F2, word 2, YERE alternately, or W, directly W you can use. But REYE is better. Okay. Then after calming effect, you can use W. Okay, direct WE try to neutralize, but it will take to neutralize. So what we can do, we can add decrease the effect with YE and increase the effect. Gradually, it will make to equilibrium level. When equilibrium level is reached, so you can add WE at that area. Okay, so this is the solar plexus nerves. Okay, so I hope you understand. So we studied 5 points today. The remaining 40 points we will divide in 3 days or mostly 3 to 4 days. We'll complete in detail like this. Okay, because we have to understood and we have to remember this problems while trading. So basically, in my opinion, and internally and externally, both will give wonderful results. Okay, so any doubts, kindly ask. Thank you.